You probably just got a very serious robot voice telling you that the meeting was being recorded. Uh, so we are kind of ready to go here. So if we can, again, great, thank you, Lisa, from MTI, putting that intro into the chat box, just so you have a sense of some of the other folks who are in the virtual room with us. And Jennifer, if you could advance the slide, please. Thank you. So this is our agenda for our time together today. Again, doing some brief introductions, giving you some background information about who Verdant is, our health program project application process. So those purpose and priority areas for our funding, the application materials, the evaluation criteria, some frequently asked questions that have been kind of curated from our last 2 quarters of doing this meeting, and may add some of your great questions to this ongoing document today. Separately, our COVID-19 emergency funding process as just kind of an FYI, and then our open Q&A for anything that we don't cover. And I think at this point, Jennifer, I will turn it over to you.
Sure. Thank you, Zoe. Hi, everyone. Good afternoon. My name is Jennifer Piplick. I'm the Director of Marketing and Communications for Verdant, and I will take you through a little bit of background on the Verdant Health Commission, our service area, and some other details as we get the conversation started today. So as Zoe mentioned, we have a board of commissioners, and you see first on this slide with introductions, you see their names and photos. So they are Dr. Jim Distelhorst, Bob Knowles, Dina Knutson, Fred Langer, and Kariana Wilson. And I believe we have both Jim Distelhorst and Dina Knutson on the call today. It's great to have you both here. Thanks for joining us. So the 5 individuals are elected to the board of the Verdant Health Commission. I'll share a little bit more about that background in a minute, but they are our board of commissioners that make decisions regarding our grant investments for our organization. We also have a staff of 8 full-time employees, as well as 2 part-time interns working with us right now. And so I know a number of staff are on the call too, so thanks for being here today. And that's a little kind of overview of who we are from a people perspective. As far as our background goes, so this slide outlines our official mission, which is to improve the health and well-being of our whole community, and we do take that very seriously. We're talking about our whole community being South Snohomish County, and I'll share some maps in a couple minutes to help give some perspective as to what we mean when we say South Snohomish County. But in a little more detail, that vision statement as a sustaining public resource, I think is an important piece to call out. And that we're really encouraging kind of collaboration and creativity in working to meet those health needs of our community. So if you're not familiar with us, the Verdant Health Commission is the program of Public Hospital District number 2, Snohomish County. So legally, we are a public hospital district. The Board of Commissioners is elected by the voters in the public hospital district to serve. And back in 2010, that Board of Commissioners entered into a long-term lease agreement with Swedish Health Services to run the hospital that we own, which is now called Swedish Edmonds and run by Swedish. And so they formed the Verdant Health Commission as the new program of the hospital district to support health needs in other ways, providing these grant opportunities to support health needs a little bit more upstream than we were able to do at the hospital. So that's a little background on us as an organization. A little background, a little additional, I guess, timeline history on our grant making work. So we began grant making in 2011, and for about 8 years, we operated under sort of a rolling review process for grants. Typically, those were reviewed monthly by our board at their board meetings, but we also put out special calls for proposals that were a little more specific, serving specific areas, things like behavioral health and also infrastructure to support community health. And so those are pieces that we did as needed and sort of as identified over that 8-year time period. The ongoing kind of one-time and multi-year program grant process was put on pause at the end of 2019 as we underwent some staffing changes as an organization. And so we were restaffing up at that time, right around the time when COVID hit in early 2020. And so that kind of further put things a little on pause. But in 2020, we were able, first of all, to get restaffed over the course of that year. And then also to be nimble and be responsive to community needs when COVID hit. That was something that we were proud to be able to support some of those community more emergency needs that came up when COVID first struck. And so we did and continue to invest in sort of short-term COVID responsive types of opportunities. So we did that in 2020, and then earlier this year in 2021, we relaunched our process for one-time and multi-year program grants. The timeline has changed a little from what we've done in the past. We are doing a quarterly review, and so if you're on this call today, you're here to learn more about our process for quarter number 3 of 2021. We have done this now twice. You see before you the quarter 1 and quarter 2 information. The board has gone through the process already twice. This will be the third opportunity we've done it using this format in 2021. And we are so pleased that we've been able to support over $3.5 million worth of program grants since the year began. So that's kind of a high level overview of the timeline for our grant making. Wanted to explain a little bit more detail about this community that we serve, that we call South Snohomish County. That can mean different things to different people depending on where you live. And so this map that you see before you is sort of in its simplest form, the look at our the geography of our public hospital district. So public hospital districts, just like a school district or a port, have a very specific geography, and ours, you see, contains several cities. So the city of Briar, Edmonds, Linwood, Mount Lake Terrace, Woodway, and then we include a fairly significant swath of unincorporated Snohomish County areas that are shaded a little bit lighter, as well as a little corner of the city of Bothell in Snohomish County. You can see our boundaries to the south. This is the county line. To the north, it's approximately 148th Street Southwest. And the eastern boundary is a little harder to pinpoint. There is no exact street that follows that perfect north-south line. But I can say that we do not go as far east as the city of Mill Creek. And another good point of reference is we do not go as far north as the city of Mukilteo. So I do have a couple of other ways to show this information to you. We recently updated kind of a detailed map of our district. And so here it's a busier map and maybe a little bit harder to tell all the specifics, but this information is available on our website. And so if you're interested in learning more about the service area that we cover, this in detail format is available for you to view. Everything in bright yellow is outside of our service area. So this boundary is our hospital district that we serve, and we have overlaid a couple of other boundaries that we thought would be helpful. So in addition to the city service areas that are using different colors to sort of designate the cities, you also see a purple dotted line that fairly closely mirrors our boundary area. That's actually the boundary for the Edmonds School District. And so on the east, they match us on the north and the south, and the eastern boundary is slightly different. But that, I think, it can be helpful information depending on the work that you're doing or who you serve. That can be useful for folks. One other way to look at it is to think about zip codes. And we know that as organizations that might be working in community and collecting outcome data, zip codes may be something that you're tracking. And so we have before you a list, the district map, again, with the boundaries to the north and the east designated with a blue line, and zip codes listed to the right. And those zip codes are either fully or partially contained in our district. And so you can see a couple of them, especially to the east, we just sort of snip into both 98012 and 98021. Those are Bothell zip codes. And so there are some folks within those zip codes that are within our service area, and a large portion that are not, that are a little bit farther east. So this information is also on our website and can be really helpful, I think, for folks who are trying to understand when we talk about our service area, what do we mean? I think I'm back to Zoe at this point.
Thank you, Jennifer. I'm going to walk through kind of the purpose of our one-time and multi-year program / project grants. So the goal of these funds is to support projects in South Snohomish County, as Jennifer has just so thoughtfully identified and defined for us, that support our mission of improving the health and well-being of our whole community. So we are seeking project proposals via this process that address priority areas that are annually identified by our commissioners. Next slide. Our current priority areas are access to healthcare, behavioral health, childhood obesity, dental care, food security, housing, other education and prevention as it relates to health and wellness, and supporting seniors. We wanted to provide a little additional context. Housing is a newer strategic priority of Verdant, and at this point, wanting to clarify that we are really looking to support.
¿Me puede dar, por favor, los 4 tacos?
Oh, there. Wanting to support program or proposals that are helping people gain and sustain housing and not the capital development of housing via this kind of grant process. Importantly, this is not a capital funds process for any of our priority areas, but wanting to call that out specifically to housing as it can be confusing. As Jennifer mentioned, we often do special calls for subject-specific things like capital, which has been called the Building Healthy Communities Fund in the past. And we may, again, do that in the future to support capital project ideas. Not as part of this process, though. And then to provide additional clarity on the other education and prevention, so ideas that support resident health and wellness, kind of that may include addressing the social determinants of health and other emerging needs, but not the direct provision of care or services as we've outlined in the other areas. The funding parameters for this request, there is not a minimum or maximum request size, although we do like to say that the average grant size is expected to be about $150,000 annually. We may fund multiple projects in each priority area, so it's not that we're selecting only one for each. Funds must be used to meet the health and wellness needs of South Snohomish County, again, as identified in those maps and criteria Jennifer shared. Funds cannot be awarded for the benefit of an individual person, for political or religious uses, to retire debt, or strictly for fundraising purposes. And funds will not be awarded in this cycle for projects that are solely capital or equipment requests. We're going to move now on to some of the application materials. And I will walk through the application and outcomes, and then my colleague Tammy will talk through the budget and financial details. Again, all of these materials are available now on our website, and we will be accepting them officially between August 16th and 27th, and they must be received by 5 p.m. on August 27th. So we're going to go through some of the snippets, kind of the most important aspects of each part of the application. Again, it is kind of this Word document and then 2 Excel documents. The application material requirements, as bulleted here, are that you need to provide the narrative itself, which this checklist is embedded in, current financial statements from your organization. And that can mean a variety of things. If you have audited financials, we would like to see that. If your organization is too small and does not need to do a audit, then Tammy will be able to work with you to determine appropriate kind of financial documents to provide in place of that. We'll also have the outcomes attachments and the budget attachment. And importantly, a change that we made it last quarter is we are asking for letters of support when proposals are for projects that are happening in another agency's facility and or really require the participation of another agency in order to be successful. Importantly, we ask for the year 1 budget request from Verdant specifically, so not your whole program's year one budget, but what your year one budget request is from Verdant. And funds, if you kind of are successful in your first year, are able to be renewed up to an additional 2 times. But it's okay if you're saying we just need 1 year of funding or 2 years, but we ask you to also indicate what you anticipate the duration of funding requests to be. This is an example of what the form looks like kind of further into this narrative document, which is a prompt and then text box. We have here at the top in all capitals that answers are required for all of these prompts. The total page count for responding to these prompts should not exceed more than an additional 5 pages, and the font size used to respond to these prompts should not be smaller than size 11. This is kind of a screenshot of what our outcomes document looks like that goes along with your application, and an example that I had used as if I were applying to receive funds for my pet palace, so to speak, for a spay and neuter clinic here. So you'll see that I am indicating the date I created this form. That's really helpful for our kind of internal tracking of when it was submitted, as well as the time period that we are requesting for funds. Importantly, through this August cycle, that will be for contracts starting between October 1st and December 31st of this year. The other piece that is required is to include the number of individuals served. All applicants need to kind of outline how many folks they think that they will be serving with their proposal. You'll see here I've indicated that I think I will be supporting 200 dogs spayed or neutered at no charge and 200 cats spayed or neutered at no charge. We also want to see some additional outcomes, although we don't have a required minimum or maximum here, but some additional ways that you would know that your project had been successful, or that you had met kind of your intention. So here I also indicated I wanted to do a community presentation about the importance of spaying and neutering your pets, to be like Bob Barker, but also because I think that we thought maybe you needed to do some community outreach to increase or be able to meet that number of individuals served. So this is an example of the form, and of course, as with all of our documents and processes, I'm happy to walk through these with you at any time as you think about how you might define some outcomes for your project. I'm going to hand the budget materials now over to my colleague, Connie.
Thank you, Zoe. So what we're going into now is the budget sheet. I found that some people find this a little bit confusing, so I'm going to walk through it a little bit briefly, a little bit in detail in the areas where I think you might need a little bit more explanation. The biggest part of this that people tend to get confused about is the titles up here where it says total annual project budget and annual Verdant request. So this is the last 2 columns on the right. What we're looking for here is we want to know the total budget for the project, not just what you're requesting from Verdant, but this allows us to see in-kind contributions. And those can vary. It just helps us detail it out and helps us keep track of that. So again, up at the top, the start date and the end date are going to be the dates that Zoe indicated, depending on your request. Some are for a quarter, some are for a whole year. Most of these are all going to be starting on October 1st. Oh, I was trying to scroll down a little. I guess I don't have that power, Jennifer. The line items are very generic. You can add more detail if you like. The numbers at the bottom, only the gray areas will you be filling in. The numbers at the bottom will calculate based on what you plug into the budget, and it'll determine what request you're making of Verdant. In this case, Zoe's asking for Verdant to fund 19% of her project. And again, that number will calculate. And that's about the detail on this.
Thank you, Tammy. And again, we don't have a minimum or maximum of that percent requested from Verdant. It is It is kind of one of the points that we always are interested in seeing, and what of the in-kind contributions there are, either from other funding sources or from other internal resources of the applying agency. Moving on to evaluation, we have kind of 4 buckets of priority ways that we are looking at evaluation. And that is the opportunity or community need for the proposed project, the community impact in how it includes diversity, equity, and inclusiveness, the desired outcomes of the project, and the implementation planning of the project itself. We do have our complete evaluation criteria on our website. So this About Us /grant information, you'll see a couple places, is a treasure trove of information. It's where you'll find all the application materials, where this presentation will be posted, where there are examples of our reporting forums, and lots of other information as well. That was specific to what we're doing, or what we call our traditional grant funding, or these quarterly opportunities to apply for annual or multi-year grants. We also continue to have access to those COVID-19 emergency funds that Jennifer referenced that were started in 2020. Just like our traditional grants, this is the same criteria in terms of serving South Snohomish County residents and supporting one of our Verdant priority areas or community needs that may be increasingly needed as a result of COVID. This can be short-term projects or pilots. Typically, the terms of the grant contract are within the calendar year that the request is made. And we accept what we call these concept papers, which will also be on the grant information piece of our website, on a rolling basis. So unlike these traditional grant requests where we have specific windows where we accept these proposals, you can provide a concept paper to me at any point, and it is reviewed kind of when received. And again, that grant information part of our website there is how you can download the concept paper. And of course, you can always reach out to me if you have questions about if you think your idea is a good fit and or to talk through what you're thinking of proposing. Moving into, I think, Jennifer, you are going to go through these of the kind of great questions we've historically gotten that we think might be helpful before we open it up to new questions that aren't covered here.
Yeah, and on the grant information webpage that we've referenced a couple of times, we do have a document with frequently asked questions that has many more frequently asked questions, not just the ones that we're highlighting here in this Q&A session. But these are ones that we hear really often and thought it would be worth taking the time during this info session today to talk through them. So the first being, do grant requests need to serve a specific population? And our answer to that is the only requirement with regard to audience is that they serve the residents of our district boundaries. Some grant requests will narrow that focus to a certain age group or certain need, but there's no specific requirements from us other than that it be tailored to serve the folks that live in our district boundaries, which those maps highlighted earlier. With regard to who's eligible, what type of organizations are eligible to submit an application, we can receive applications from nonprofit, from for-profit, from government organizations, as long as the projects and programs match our eligibility and our guidelines. So we're open to those options. A question that comes up from folks we have funded in the past or who may be currently funded by a Verdant grant, and if it is set to expire, is this the same renewal process that we are using? And that the answer to that is yes. We do recommend that anyone currently being funded with a Verdant grant that's set to expire use this application process in the grant cycle window prior to when your current contract is set to expire. If you're not sure about those details, feel free to reach out to Zoe and she can help answer questions or talk you through when the most appropriate timing would be for your specific project or program. A question we sometimes receive too is, can I submit multiple applications? And the answer is yes. A single organization is not limited to only being able to apply for one grant per funding cycle. We are accepting applications electronically is the process. If you have any questions or uncertainty, if there's barriers to you or organization, please reach out to Zoe and she can work with you independently on that. This question is what's changed in 2021 for Verdant with regard to reflecting equity, diversity, and inclusion. And so this is an area that we've broadened in this year. When we began funding new requests again in 2021, we elevated collecting information about how the program or project demonstrates diversity, equity, and inclusion. And it will be part of what's being scored in the application. So specifically, we're looking for information on how the populations that will be served by the grant have been involved in the implementation, in the development, in the evaluation. How did that audience engage in the development of this project or program that you're requesting? And similarly, how does the program or the organization staff reflect the population that's intended to be served in the grant? So these are areas that we know are evolving for a lot of organizations, and many organizations are at different places depending on the type of work that they do. It's something we're currently developing better plans to include community in our own process internally as well. And so we're working on developing plans for Community Advisory Council that would bring community members into our process of reviewing and having conversations around grant applications in the future. So as an example, that's something that we are also continuing to improve upon on our part. And we understand that many organizations are in similar boats. So this is sort of a snapshot of the timeline for this quarter. So earlier this month, we announced sort of the opportunity for the next funding cycle, this third quarter funding cycle. If you're here with us on the call today, you know you're part of the community Q&A session that's happening right now on July 12th. The application window for submission is August 16th to the 27th. And so that deadline on August 27th is at 5 p.m. We did schedule today's Q&A session a little bit earlier in the period to give more people time to review the opportunity and ask questions if needed. And so I'm not sure if anybody participated in previous ones, but we've given a little bit more window of time to give folks opportunities to think and draft and ask questions and whatnot in advance of that acceptance period from August 16th to the 27th. Once applications are submitted, they'll go through an internal review process, and then the week of September 13th, the program committee of our Board of Commissioners will review it during their committee meeting. That's the first round of review at the board level. And then the second opportunity is the full board review that will take place at our September regular Board of Commissioners meeting, which is happening on Wednesday, September 22nd. At that point in time, we expect that the board will make decisions around this cycle, and we would then be able to communicate with all applicants either that same day or the following day. So September 22nd or 23rd would be the time applicants would be notified of the decision that was made at the board meeting, with contracts scheduled to start October 1st. This cycle will happen again one more time. So the fourth quarter of 2021, the period for accepting applications will be sometime in November. We're revisiting with a couple of holidays that month what would be the best opportunity, what would be the best window of time for that. And so we'll post on our website the details around those exact dates. But we wanted to let you know that it's possible that at this quarter, you may be interested and ready to apply. You may also be doing some research and thinking ahead. And so knowing that the fourth quarter of 2021, there'll be another opportunity in November to apply for funding. Put up on the screen right now, the contact information for both Zoe and Tammy. They are your best points of contact if you have specific questions following today's Q&A session. But we're also very interested in answering any questions that you have for us right here that would be helpful for folks to hear as a group. So with that, I think I'll open up to questions. And I'm not sure if we received any in the chat.
Doesn't look like it. I also wanted, as people start brainstorming their questions, if you have any, another point on the November time period where we're also waiting to confirm dates. In addition to what Jennifer shared, is we also will be implementing an electronic grant management system. So we will be accepting our applications via a grants portal, which we're very excited about and in the midst of developing, but wanting to confirm all of the kind of timelines there and assuring that we have lots of time for training for folks who have not previously submitted applications in that format, to make sure that we've got a lot of head time, so to speak, to support folks in the training and technical assistance piece.
So we
Lots
just
more
got-
will come on that.
We just got a question. Did I hear correctly that Melissa Ralston asked, did I hear correctly that you are asking for letters of support from partners?
Yes, so great question. Yes, in the event that the proposed project includes another partner's facility and or participation as kind of a critical component of being able to be successful. If you're in a place where you work with a whole network of providers and kind of you say, well, whoever is filling the space of a social service provider, for instance, we would partner with, you don't need to provide individual letters from every single place you work with. But if you said, like, I want to create an after school program and it would be within Zoe's Pet Palace, for instance, you would want a letter of support from Zoe's Pet Palace saying, yes, I am committing to providing the space for this program to happen. So we got another question, is there a separate fund for capital equipment funding? So we are working on kind of how we want to prioritize capital requests in the coming year. And so at this point, we do not have an opportunity for capital or equipment, but we are in active discussions about when we might.
Please expand on DEI.
Great question. So I can say broadly, and then if there's a specific question there, happy to answer that after. As Jennifer shared, I think we are trying to do the work internally of building enhanced kind of understanding and knowledge of staff and commissioners around the important tenets of equity, diversity, inclusion. So really working to have that be part of our lens on how decisions are made and who is involved in that decision making. And at the same time, wanting to better understand for folks applying for funding, if they are applying for funds on behalf of a specific population or subgroup, well, how are those folks involved in this proposal? Is this what the community feels like is an appropriate response? Is it a need that they find is significant? And further, does the staff who would be implementing this program include members of that the community that is being intended to be served? So we're really trying to balance the internal and external work, because we know folks move forward, and the goal is really to honor all members of our community and assure that we are funding folks who are best able and best qualified to serve diverse community groups, hoping that they're from the community itself. Did that, I'm looking for the box that Arun is in. I see you. Did that help answer your question at all, or do you have a follow-up question?
Yeah, I think I get the gist. And what's the outcome? What is the success criteria for Verdant to say, yep, we have met those KPIs for DEI?
Yes. I think it's so challenging. It's a good question, because there's not really a key performance indicator, right? This should just be how we all do business and move through the world all the time. So it's not something that you can just check off and be done with. In terms of how we're trying internally is to say, how do we have ongoing involvement of community members in our grant making decision making process, so that community advisory group, and how we are making kind of strides in our own policies and procedures, and were we to have hiring opportunities. In terms of the grant evaluation, really that is just, how did people respond to those prompts around how was the community involved? And so we've had some folks that just do not respond to that, or, respond briefly. So it's not that It's really around the intention, I guess, of inclusion, knowing that a lot of folks are at different places in this process or have been doing work for a long time in a community, but the staff may not necessarily be from that community. So it's a balance of trying to understand the intention or the work that they themselves are doing, kind of long-term. And we're trying not to have it just be a check the box. We're also doing that work internally as well to identify how we best do that.
Thank you. I appreciate that. And I actually appreciate Angelique because she's the one who gave me some guidance and asked me to join here. So,
Oh, I'm glad to see you. Yes, I'm glad you're here. And I think it's such a good question, and one I think that, you know, we all need to keep talking about, not just in this sector of funding and grant making philanthropy, but I appreciate, you know, Angelique as well. And in this philanthropy community, I think lots of folks know there's a grant making kind of equity group where we're all talking together locally around how we can enhance a focus on equity in our processes and work together to move forward in this work. So thank you, Arun. Thank you, Angelique.
Zoe, can I ask a question?
Of course.
Could you expand a little bit on deciding if you should apply for 1 year, 2 year, or 3 year funding, knowing that your program could change, enhance, and, you know, how do you get sustainable funding and renewable funding and still not be pigeonholed into what you might have written 3 years ago?
It's a great question. And really some of the intention here of not locking people into a 3-year contract term is to allow folks to have some flexibility. And so the budget and outcomes actually would be finalized annually. So if you say, I'm going to, you know, I am either starting a new program or we have a program not currently funded that we don't see go, it's not going to go anywhere, right? But this is what we know we're going to need in the next year in terms of staffing, or this is what we're really focused on this year in terms of the demographics we're going to be reaching out to. But in year 2, that might change. Maybe we're adding something, or we have a bolus up front of planning, et cetera. That would allow you flexibility in the years 2 and 3 to kind of resubmit your desired budget and outcome for approval. The goal, though, is to fund successful projects for those 3 years if they meet their year 1 outcomes.
Great, thank you.
Did someone just, I like hear the unmute and I'm like, oh, someone has a question. Was there a question?
I can ask one more question.
Oh, great.
It's not, what is that?
That's okay.
So the letters of recommendations are kind of assurance that the partners you were working with will also are also aligned with the ask, right?
That's exactly right.
Is there any other kinds of letters of recommendations that can build up the need for the project, or the kind of recommendation of the quality of the nonprofit that's asking for that?
Absolutely. So I would say welcome, but not required. So the ones where we say you kind of have to do this are if this person doesn't commit to this work, the program can't happen. But if you have a letter of support from a program partner that doesn't fit that criteria, but you think that their vouching for the work is strategic, absolutely include that. So I would say welcome, but not required in that context.
Thank you.
Excellent. I'm gonna look up in the chat. Great. I think we got all the questions there. And again, if you put your email address in the chat box, we will email the recording of this call and the slides. They will also be on our website. So, you know, no worries if somehow that box got missed. We will spam you with this information in any way we can. Not really, but always if you have a question after the fact for your processor, I really do hope folks will reach out to talk through some ideas with me. I'm always happy to look over a draft, or if you're trying to think through, you know, should I submit this now or in November? Would this be better as a COVID concept paper or this traditional grant request? Please do not hesitate to reach out to me. And I would love the opportunity to talk more.
Nobody's asking a question, so maybe I can ask one last before you.
Yes, I like it.
So do you also support events where the community comes together and there's an opportunity to talk more about health and
Yeah.
other things?
Yes, so great question. We do have an event sponsorship process. So there is, if it's specifically an event is being put on and you're kind of seeking sponsorship, that you could, and I believe, Jennifer, that is on our website now, that request form. Or it will be on our grant info probably. So there is
I
a way
was
of
just
saying,
double checking, yeah.
yeah, to request specifically support for an event that is not programming or kind of any duration of engagement. We do have a process to request support for a one-time event. Or if you were saying we want to put on a series of events, or to say we want to do some sort of community sessions around a health or wellness topic, you know, that could potentially be a grant proposal. So that could be a good one to that we could talk through further.
And is there any timeline that I'm talking about an event, a major event that my team is doing on August 15th. So is there a timeline that you need to apply within 30 days, 60 days?
We don't have a firm timeline like that for the event sponsorship, but Jennifer, that's kind of more of the marketing communications piece. Jennifer, do you want to?
Yeah, I'm open to that. And so I will follow up with you and make sure you have that information. Oftentimes the events, typically the high end of the request from a dollars perspective is around $5,000 is what we've identified through that process. If it's a larger than that event, it may be better suited for a grant, just sort of depends on the circumstances, but happy to learn more about it and talk through that with you. Again, similar requirements that it be those health connections be there, that it serve and take place in our community is a piece of that as well. But that would be a very welcome request also. Thanks for asking.
It has to happen within those boundaries that you talked
Yes, that's one of the qualifiers that we have. There are so many wonderful events happening just kind of outside our community. That's one of the ways that we've kind of narrowed this to ensure that it's focused on our kind of South Snohomish County demographic.
Thank you.
Good questions. I love questions. Well, excellent. And Jennifer, I think in other quarters, we have noted that we have Jim and Dina with us, who are two of our commissioners. And I don't know, Jim and Dina, if you wanted to say anything or introduce yourselves, say hi before, if there are no other questions.
Hey, I'm Jim Distelhorst. I'm a retired family physician and one of the commissioners, and I was able to review the grants in the last quarterly review, and it was a good education for me too. So you're doing a lot of wonderful things in the community, and all of us here at Verdant really appreciate it. So thank you for your work.
And I'm Dina Knutson, and I've been with the Verdant Health Commission since about 2000. And I'm actually the chair of the program committee right now. And I always enjoy listening to all the new programs that are coming forward and love working on this. So I'm looking forward to another really productive quarter of funding opportunities. So thank you for coming.
Thank you, all of you.
Thank you, Jim and Dina. All right. Well, if that is no more questions, and again, not a one-time offer on questions, call me anytime. We will wrap up this session and share the recording and slides with you soon. And look forward to hearing with you. And thank you for all of the good work you do in our community.
Thank you.